I want to confirm the government's commitment to continue allocating funds for the recruitment of teachers in primary and secondary schools annually. This commitment goes hand in hand with the improvement in teachers' welfare. And I want to state here that because we are rolling out NHIF for all students in 2.8 million of them in secondary schools, I want to ask the Teacher Service Commission to also consider expanding the health insurance coverage currently enjoyed by teachers to also include benefits like evacuation and foreign treatment if it is required. I think it is something that as government we can work with the Teacher Service Commission to make sure that teachers who currently have a health insurance cover, that cover is extended to include evacuation by air if need be, so that more teachers can have access to facilities to be in line with other members of the public service. The National Education Management Information System is a streamlining tool to produce accurate data, reliable statistics, and integrity in record keeping. This will lead to effectiveness, efficiency, and transparency in education management. It will facilitate tracking of learners' progress from early childhood to university in a unique person's identification, commonly known as UPI, enabling stakeholders to access rich and effective statistics at the click of a button. The comprehensive student medical cover will usher in improved learner health care throughout the country. It will be managed through the UPI as well. A textbook distribution policy, and I think on this matter of NHIF that will be provided for every student, we have given directions that the service providers that will be identified by the NHIF must provide this service inside the school. We do not expect students to leave school to go and look for this service. And yes, except if they are going for inpatient services. But if it is outpatient, all outpatient services must be provided in the school. And all service providers must prepare themselves to work with the school management. Where we have facilities in schools, those facilities should be expanded to accommodate the new facilities that will come with the provision of health insurance. And where none exists, the ministry, together with the service providers, must figure out how this is going to happen. We do not want kids loitering all over the place, looking for somewhere to be treated. A textbook distribution policy will equip every learner with 6 textbooks when joining Form 1. The scheme will improve efficiency in delivery of learning materials, which will reduce costs considerably. Disadvantaged households will experience a far diminished financial burden with increased capitation for free day secondary education. This capitation, as you all know, has increased from Kenya shillings 12,100 to Kenya shillings 22,200. Through the Ministry of Education, we are investing in expanding school infrastructure and ensuring boards of management's capacity, as well as parent-teachers associations, to drive up the quality of school governance. This will enable school communities to tackle gender disparity in resource allocation, harsh environmental conditions, insecurity as well as drug and substance abuse, and indiscipline. As you can see, our determination to transform Kenya is matched by our commitment to deliver transformative education in our Kenyan schools.